Good afternoon. My name is Courtney Andrews. I'm the Program Manager at the Institute for Human Rights at UAB. Thank you so much for joining us today as we continue our virtual series on human rights in times of COVID-19. This week, our focus is on how the pandemic impacts the right to education, which of course is of mounting concern as we go into the fall, and school districts and universities are making some really tough decisions about what education will look like for the time being. We are joined by three expert panelists today who I will introduce in just a moment. First of all, for those of you who aren't familiar, the IHR serves as an internationally renowned platform for interdisciplinary interaction and collaboration for scholars, students, practitioners, and activists. Under the leadership of Dr. Tina Kempen-Reuter, we focus on education, research, and outreach. And our mission is to promote and protect human rights locally, nationally, and globally. You can follow us on Facebook and Twitter, and please go to our website and sign up for our newsletter so that you'll know about all of the events that we have coming up. And also please check out our blog where we post on all manner of human rights issues. So moving on to our panelists, we're very excited to have three panelists today to lead our discussion and share their expertise with us on how the pandemic affects the right to education in communities in Alabama and across the country. Our first panelist is Dr. Tondra Loder-Jackson. She's a professor in the UAB School of Education's Educational Foundations program, as well as UAB's African American Studies program. She's a founding member and former director of the UAB Center for Urban Education and has worked in nonprofits, schools, and universities in Chicago and Philadelphia before coming to Alabama. Dr. Loder-Jackson is also the author of Schoolhouse Activists, African American Educators and the Long Birmingham Civil Rights Movement. So thank you, Dr. Loder-Jackson, for being with us today. We also have Dr. Tonya Perry, who's a professor in the UAB School of Education as well, and she's also the executive director of Gear Up Alabama, which is an educational initiative in the Black Belt region of Alabama. Dr. Perry was also recently appointed the director of Cultivating New Voices Among Scholars of Color. In her role there, she plans to innovate, support, and implement programs, initiatives, and structures that are imperative for the next generation of literacy scholars of color. So thank you, Dr. Perry, for being here. And finally, we have Dr. Ashley Kuntz, who we are very sad to see leave UAB, but we're excited for her to assume her new role as the Director of Scholar Development and Clinical Assistant Professor of Educational Policy Studies at Florida International University. So thank you, Dr. Kuntz. Thank you all for being here today. Before we begin our conversation, I wanted to read Article 26 from the Universal Declaration of Human Rights and let this be our guiding framework as we talk about the right to education and how it's very interwoven with other human rights and how we can go about ensuring the right to education even as the pandemic presents a number of barriers to doing that effectively. So Article 26 says that everyone has a right to education, that education shall be free, at least in the elementary and fundamental stages, that elementary education shall be compulsory, technical and professional education shall be made generally available, and higher education shall be equally accessible to all on the basis of merit. It also says education shall be directed to the full development of the human personality and to the strengthening of respect for human rights and fundamental freedoms. And lastly, it says that parents have a prior right to choose the kind of education that shall be given to their children. So with that in mind, I'd like to begin by asking a general question to all of you, which is, how has the pandemic affected the right to education? Particularly with the switch to virtual instruction, which most schools across the country switched to back in March. And then also as we consider what kinds of issues we face going into the fall. So Dr. Loder-Jackson, would you start us off, please?
Yes, and I'll speak to how the pandemic has affected teachers' rights and their health and safety. I believe it's imperative to include teachers' voices in our discussion. So in that spirit, I'd like to share a quote from a teacher in Florida, Frederick Ingram, who captures the sentiments of many teachers across the nation, I believe. He declared, "No one wants to be back in a classroom and reopen our school buildings more than educators. We are teachers. That's what we do. That's what we live for. That's what we've given our lives to help kids and communities and families, but we want to do it safely and we don't want to put people at risk. Notably, Interim is one of 3 teacher plaintiffs filing a lawsuit against Florida's governor and education commissioner, and they're joined by the Florida Education Association in charging that state officials are violating the state constitution's mandate for, quote, safe and secure public schools, unquote. One of the 3 teacher plaintiffs is a 53-year-old COVID-19 survivor, and she spent 8 weeks in the hospital, 3 of which on a ventilator. She didn't have any major underlying health concerns, although she mentioned some manageable bouts of asthma. So their battle at the state level actually prompts me to circle back to Dr. Andrews' opening reading of that UN Declaration of Human Rights related to education. This is a profound set of declarations established by global leaders in 1945, but they were then and they still are quite aspirational. Especially the notion of a right to an education in the United States. The Constitution doesn't mention an express right to an education. The 10th Amendment grants states and citizens some purview over matters on which the Constitution is silent, and it also prohibits their authority or rights on matters that are under the purview of the federal government. So the right to an education is generally enacted through state constitutions. Now, I should add that we have the First and 14th Amendments of the Constitution. You have Supreme Court decisions like Brown versus Board of Education and others, and some congressional laws, Title IX and others. They certainly do grant teachers and students some rights, but by and large, it's the states that govern and finance education. So there's some observers who actually question whether teachers have rights per se as it relates to COVID-19 in the workplace. Do they have a right to decide if they'll return to brick and mortar classrooms? Do they have a right to decide what kind of instruction they'll deliver? So prior to COVID-19, teachers' rights generally entailed their freedoms from discrimination, certain types of discrimination, age, race, sex, national origin, discrimination when a woman is pregnant. Also, like other citizens, teachers have certain freedoms that we get from the Constitution: freedom of expression and association and a religion as it relates to the workplace. To a limited degree, they have some freedoms around privacy, but those are limited. Now, Article 23 of the Declaration of Human Rights states that everyone has the right to work, to free choice of employment, to just and favorable conditions of work, and to protection against unemployment. But I would say that a right to work in a safe environment is really being put to the test now with teachers in the United States, and of course other workers. And so as we embark on the new school year, the 2 most pressing questions for teachers are: how will their school districts ensure their safety? And if they get COVID, how will their districts take care of them? And teachers want to have a say in these decisions, which I will discuss a little later.
Great, thank you. Dr. Kuntz, do you have anything to add?
Yeah, so I think from the perspective of higher education, it's really important to note that even in the Universal Declaration of Human Rights, what we see is that the right to higher education is pretty nebulous. And it's also morally problematic, I think, because what we hear is that higher education should be equally accessible to all on the basis of merit. But around the world, what we know is that access to higher education is often predicated upon tracking that begins early in one's educational trajectory, or standardized tests, and other such factors that are anything but neutral. I mean, if you have large inequities in your early educational system, then you will see these perpetuated at the higher education system. And that is exactly what we see here in the US. It's a huge problem. The college preparedness level of high school seniors depends so much on the zip code they were born into and the types of educational resources that they had the opportunity to utilize earlier in their career. So, you know, I think even before COVID, it's really important to point out that we had huge issues of college access in our country, and the right to education was not a secure one here. So I do think that COVID, though, has amplified some of these concerns and really heightened our awareness of them. And so one way I like to think of this is there's a difference between having a practical access to higher education and having meaningful access to higher education. So from a practical perspective, any student can apply for college admission. But in terms of meaningful access, we have to consider the fact that even before COVID, we had the issue where many colleges and universities would not visit high schools and educate students who were from the most marginalized groups. So the students that needed the most outreach and education, the students who were attending schools that did not have college admissions counselors employed, who may have had large numbers of students with socioeconomic need. There was already a gap, and those students already were not receiving the educational resources they needed. And prior to COVID, what would often happen is that those students would attend large metro area college fairs. And that's how they would learn about college. They would learn about the opportunities available to them. Well, this is just one way in which meaningful access has really diminished during the time of COVID. And it's challenging college admissions professionals to figure out how they will be more innovative in the way they educate and you know, help students fund their college education. So, you know, that's one example. I think another thing to note is that traditionally when the economy slips into a recession, we see an uptick in college enrollment. But there are some early warning signs that this may not be the case in COVID. There are unprecedented levels of unemployment. And what we're seeing is that in the spring, far fewer students were reapplying for their federal financial aid. There's a study done by the National College Attainment Network, and they actually have a public-facing record that you can consult online. And what they found is that over the summer, students in middle-income situations have started to reapply for financial aid. That is a signal they will be coming back into colleges and universities. However, for students who are in households with less than $25,000 of income, what we see is 4.9% fewer students have reapplied for FAFSA. So we know those students don't have the money to attend college. So if they're not applying for their federal aid, then we can only assume they are stopping out of the higher educational system. So this issue of access, I think, is a real problem. And what we know is that earning a college degree equates to higher earning potential later in one's life. And so short-term decisions students may be making, and we can certainly understand why they're making those decisions with the financial situations of so many families so precarious. But these short-term decisions to stop out of college may actually widen the economic gap that we see in our country going forward. And so I think that is a real concern about the right to higher education in our country.
Great, thank you. I really like that distinction that you make between practical and meaningful education, because I think it really shifts the burden away from the individuals to the system to create that experience for students. And Dr. Perry, I know that you can talk more about those issues of access and connectivity as well.
Yes, thanks, Dr. Andrews. In the Universal Declaration of Human Rights, as we've been referring to, Article 26 that you read also includes parents have a right to choose the kind of education that shall be given to their children. Let me talk some more about that. In this time of COVID-19, one of those choices is virtual instruction. However, this is not readily available, I believe, to all families for a variety of reasons. I'm the Gear Up Alabama Principal Investigator, and I and my team, we serve about 9,300 students and their families and schools in the Black Belt region of Alabama. The Black Belt region has a rich, proud history, perseverance, overcoming, determination. But as many of you know, the region has struggled economically with workplace development, and it's been a challenge for a number of years. So in our grant, 80% of our families are Black, 16% are white. The average income is $27,000, and more than 85% of our students qualify for free and reduced lunch. So I want to give you that foreground that, so before I begin to talk more about it. So in COVID-19, when it first hit our state, many of the school systems were very proactive in thinking about the health of the community and the safety of their children and their teachers. And, you know, we closed around March 13th or a little after. But I'm reminded of a young man. His name is Ronald. That's what we'll call him for this. He was enrolled in UAB START. He's a dual enrollment student at UAB. He has a 4.0 average after taking many classes here during his sophomore, junior, and senior year. But let's call him Ronald. He depended on his high school's computer and his high school's internet connection to complete all of his assignments. And as a smart and as genius as he was, and as he is, without these tools to complete his work assignments, he's negatively impacted with COVID-19. But Ronald is not the only one. He represents so many students across the nation and the state of Alabama who are engaged scholars but lack the tools in a time of online learning. So as I stated, parents have a right to choose the kind of education, but really, do Ronald and his family members and others across the country like him really have a choice? So I just wanted to open this discussion by saying that COVID-19 has exposed some real gaps that we have across the nation, particularly in virtual learning and education as a whole. We have an availability problem, and we have a financial challenge when it comes to education. Here, particularly in this instance, is technology readily available? Is the equipment available? Is it affordable? Is the internet available? Is it even in the areas in which we serve, And is the internet even affordable? These are all questions for us to even think about in this virtual space, in addition to the others that were mentioned by my colleagues.
Great, thank you. Yeah, and I wanted to sort of stay on this theme of disparities as we talk more about you know, who is sort of primed to get ahead in this situation and who will be left behind. Certainly, the pandemic has created a lot of instability and uncertainty for everyone, including children who are well off socioeconomically. However, we know that children who are in less privileged situations are suffering in different ways, and that the pandemic has created new forms of exclusion. And like you said, new gaps and cracks in that sort of equal access and equal right to education. So Dr. Perry, what do you think are the most concerning disparities, and what do you think the impact of those will be in the short term and in the long term? And then I would also ask you to comment on sort of what the implications are of these issues outside of the classroom, because we know that school often provides a safe, structured environment for students. Like you said, students often get meals at school. And so how do you see that extending beyond the classroom, and what can communities do about that?
Thank you, Dr. Andrews. I want to continue on the same vein I was talking about, a little bit about virtual learning, and then go into some other aspects. One is that the access and financial support for technology for all students is a challenge. In the Black Belt, 22% of our households don't have a computer. And more than 44% of those households in two of our smallest counties, Greene and Perry counties, they don't have a computer at home. And that was from a July 2020 report. So equipment is an issue. And then we have the issue of connectivity. According to Broadband Now, the coverage of a broadband internet is unevenly dispersed across our state. In the county where we are, which is Jefferson County, where UAB is housed, we are covered by about 99.6%. Now, that doesn't mean that 99.6% of our students in the county of Jefferson have access to and can afford the broadband, but it is available. But when we talk about is it available and is it accessible in other areas, like our rural areas in the Black Belt of Alabama, I want to give you just a few statistics. Broadband is not even a choice largely in some of our communities. I'll give you a few counties. In Lowndes County, broadband coverage is at 17.6%. In Choctaw County, broadband is at 28.5%. And in Greene County, it's at 44.0%. And in Perry County, it's at 0%. So COVID-19 has exposed these gaps in virtual learning for those who have access and those who do not. The CARES Act is a start, but it will not fill all the holes in the systemic problem. Inaccessibility to technology will cause an even larger divide for marginalized populations. So Dr. Andrews, I just wanted to further tell you about the digital divide and how virtual learning is going to impact marginalized populations. But I also want to talk about these other disparities and what we're seeing. COVID-19 has shed some pretty dark spots on our infrastructure. Some things that I've been looking at and concerned about. One is the zip code of a student should not dictate continued student learning, but research shows that it does. This is out of a New York Times article, and it was an analysis of about 800,000 students who did online math programming before and after beginning of COVID and now. It found out through late April, student progress in math decreased by half in classrooms located in low-income zip codes, a third in classrooms in middle-income zip codes, and not at all in high-income zip codes. I think that's pretty telling. It tells us that parents who have the resources, the technology, the connectivity, the resources to stay at home or to hire someone who can assist with learning, all play a critical part in this look at education. In America, the research is currently saying that COVID-19 will have none or less impact on academically on students from wealthier families. And that is something that we need to be concerned about. A second issue is that access to a live teacher in real time is important for continued learning. So that means that teacher professional development and digital pedagogies will need to strengthen. But there has been some research that says that when teachers are live and when teachers can actually interact with students, more learning occurs, more so than when the learning is recorded or when the learning is only on paper and there is no interaction between the student and the teacher. And this comes from the Center for Reinventing Public Education, which is a think tank that now does an analysis about the pandemic and the learning. Something else that we need to be concerned about is that I don't want to perpetuate a myth here. Research is showing that parents are working with their children at home and economics is not an issue. What do I mean by this? The disparities in educational progress do not appear to be caused by any lack of effort on parents. We're either the poorest parent or the richest parent. They all spend about 13 hours per week helping their students, their children. So parents are really in there doing the work, working with children. And it is a myth that children who come from families that are marginalized, their parents are not working with them. That is not true. And then the last thing that I just want to add here is that students and families will need support through this pandemic with community resources. And what I would call, and they would need less policing and more circling to get through this time. So the social emotional support that we can provide for families, whether it's community support and how we rearrange our communities and provide support for each other, whether it's through food banks and our churches with community access for feeding programs, for mental and health programs. However, we need to rearrange ourselves as an opportunity for us now to think about how we can help families get through this. And my comment here is that we will be stronger on the other side of this, but there are some disparities. There are some things that COVID has illuminated that we really need to address here in all of these areas.
Great, thank you. Yeah, I like the that you talk about, you know, when we talk about parents having the right to choose, what we're really talking about is not so much making good choices, but having good choices that are available to you. And clearly we see disparities even in what's available to choose from. So thank you for that. And Dr. Kuntz, moving on to sort of the higher education learning environment, What are you primarily concerned about with regard to access and meaningful engagement, as a lot of universities are shifting to either high flex models or fully remote models of learning? What do you see as the sort of long-term consequences of that, and in terms of widening the opportunity gap in higher ed?
Great, thanks. So I think that what Dr. Perry said, it holds true at the higher educational level too, right? It's certainly there are college students who may have technical, practical access to smart technology. They may have a phone, they may have a computer or a laptop, but it may be limited in what it can do with regard to virtual instruction. So I think there is an idea that everybody's walking around with a phone so everyone can do e-learning or virtual learning, but that's not actually the case. You may be living in an apartment, the broke college student, that actually is true for a lot of students. And you may be living in an apartment with, 4 or 5 people who are also trying to access e-learning. And they may be, there simply may not be enough Wi-Fi to go around. Or maybe you're at home with your family quarantining, and you've got mom and dad who are trying to keep jobs, aunts and uncles. You may have little siblings who also need to do K-12 instruction online. Or maybe you are an adult student and you have a family of your own. And so your kids need help and they need to utilize the internet, but then you also need to take your classes. So universities are doing things like setting up free Wi-Fi spots in parking lots. It's a great first step. It does provide some practical access, but again, is it meaningful access? Well, probably not, because, for the students who maybe have children at home, right? They can't go sit in a car in a parking lot for 3 hours to attend a class. That's not meaningful access. And, also for other students that may have disabilities or health conditions that would preclude them from doing so, that's certainly a barrier. So, I think universities are trying, and we've seen a lot of universities ordering webcams and trying to send those to students, but it's, webcams weren't easily accessible when COVID hit, right? So we're trying to catch up as quickly as we can, but we still have some gaps in the system. The other thing that I think is important to point out is prior to COVID-19, we know that 17% of community college students were experiencing homelessness, and 14% of students attending four-year universities were experiencing homelessness. Now, in light of COVID and what we know is a very precarious financial moment for our country, those are likely underestimates for the numbers of students who are experiencing homelessness or who are quite close. They may now at this point be exhausting their savings, no longer able to pay rent. And for those students, the decision about whether or not the class will be offered online is just the first level decision. They have so many other concerns. Will the residence halls be open? If we have to close the residence halls due to another spike in COVID infection rates, where will they go? And so I think it's very easy when we see universities wrestling with these decisions to be a little cynical and say, well, of course they shouldn't open the dorms, but you're not dealing with a student who is really desperate for that housing. So I think that's a real concern. And then, I would be remiss as a mom of children who's currently trying to wear both hats here, if I didn't just highlight that the Universal Declaration of Human Rights says that we have a right to family. But in the time of COVID, I think we are seeing such a testing of that right to family. We saw a couple of weeks ago that Florida State University revealed some HR language saying that families would need to have childcare so that they could work during the day, standard business hours. There was a backlash. They've since clarified their language to say that, of course, they know that people will have to be caring for children. Schools aren't open, daycares aren't open. But I think that from a caregiving perspective, working parents, children, it's just the first layer. It's a pandemic. Many people will be caring for grandparents in the home, critically ill, elderly family members in the home. What can we do by way of grading policies, by way remote work policies to ensure that we have flexibility, that we have a better social support network and a safety net for people who are impacted by the pandemic, whether financially or health-wise.
Great, thank you. Yeah, and there was a similar incident at the University of Alabama, the School of Nursing. They sent out an email saying, essentially saying to parents and by implication mothers, that if their children were doing virtual learning, that they should consider quitting so that they could, find a replacement. So it's, again, another example of that just really insensitive language, and also it highlights how interwoven the right to education is with these other human rights that you mentioned, the right to housing, the right to food, all those kinds of things. So thank you so much for your perspective on that. And I wanted Dr. Loder-Jackson for you to comment a little bit on how this is impacting teachers, and not only teachers, but administrators and even the janitorial staff. I mean, in primary and secondary education, this is an issue, and certainly with universities, which are often, very large institutions that employ a number of people. But primarily with concerns about teachers. Do you think teachers have been engaged or consulted in this process with developing reopen plans, and how do you see districts or universities supporting teachers in that process?
Well, I'm definitely not convinced that teachers have been consulted or have had their needs and concerns addressed as much as they should. Looking at some recent polls about what teachers are feeling right now, getting a pulse nationally, 20% of teachers said that they're unwilling to go back into school buildings this fall. 43% of teachers said they personally have a high-risk condition, and about half of them live with someone who is at high risk for serious illness due to COVID-19. In one poll, notably, about 18% of teachers are older than 55, or let's say nationally, 18% of teachers are older than 55, and that puts them at higher risk for severe illness due to COVID. In a Gallup poll, about 3/4 of teachers said they were very or somewhat concerned about the health implications of returning to in-person instruction. So to bring this a little closer to home, in Alabama, we have 1 in 4 teachers who are 50 years old or older. There was a teacher shortage before the pandemic. There's also a substitute teacher shortage, according to some reports. And of course, we know that will affect teachers who need to take off for themselves or for their loved ones. Governor Ivey recently mandated masks in schools and colleges for employees and students in 2nd grade and above through August for now. So that, is a positive sign. We've also seen some superintendents recently who seem, in my view, to be carefully weighing public health advice with input from parents and educators and staff, and they've decided to offer virtual instruction only, at least for the first portion of the fall term, and that is Birmingham City Schools and the Jefferson County Schools, which notably serve populations in the communities that are at higher risk for contracting the virus. There's a natural tension between what I'm presenting and what Dr. Perry is. And I can feel that. And I feel the teachers feel this. So I'm saying good news for adults to be safe, but she's already discussed, the negative impacts on students with virtual learning, but I do need to point that out. Nearby in Georgia, in the Gwinnett County Public Schools, they reported about 260 employees who've called in to say that they either have COVID-19 or they have possible exposure to the virus. So what are some of the decisions that educators are making, especially when they don't feel like they're being heard? Some are taking early retirement. That was not intended for some of them. Some are taking unpaid leaves of absence. Some are quitting altogether. You have those who are committed to staying, but there was one report that said many of them are writing their wills now. And I'd say the people in the financial sector would say that's something we should all be doing anyway, but that is a signal to what their fear. Some have already decided that they're not going to visit their elderly parents and grandparents in the fall or in the academic year. But I can say personally, having one of my parents who had what was supposed to be routine eye surgery turn into emergency eye surgery and several follow-up visits, I and my sibling and his wife, we needed to work together to be at the hospital for hours of time to be there for. So it's really not reasonable to say that you're not going to be there for your senior relatives and that you're going to try to avoid being in a hospital setting. Sometimes it does happen. You have teachers who are protesting. Detroit, Chicago, Fairfax County, Virginia, the Shelby County schools in Memphis, Tennessee, in Arizona and Florida. On Monday, there was a National Day of Resistance that was organized by teachers unions and some other organizations. So contrary to the view that teachers, the majority of whom are women, contrary to the view that they're passive, they have a long-standing tradition of resistance and activism both within and outside of unions. Black teachers in particular have a long history of fighting for better conditions in their schools, not only for themselves, but for their students. So they've had a dual battle for years. And as a Chicago Teachers Union striker, and she was striking prior to the pandemic because of just your run-of-the-mill problems that we have in schools, she said, I'm willing to do what it takes to provide for my family, just like I provide for my students and their families every single day. So I think it's important when we see teachers protesting and striking, not to think of it as being a selfish act. This is a group of people for whom it's a very tough decision to do so. And I will also note that you have some teachers filing lawsuits. I mentioned that in my opening statement in Florida, but the two major teachers unions, the American Federation of Teachers and the National Education Association, the presidents of both of those organizations have made it very clear that if they have to file lawsuits, if we have to strike, that's going to happen. The NEA president in particular, Garcia, she mentioned in response to the Trump administration's mandates that you be back in school in person, she says, none of us should accept the false choice. There are ways to mitigate the risk. It will be costly, but it's worth every dime. We will not open an unsafe school. Nothing else is acceptable. So the major risk to teachers is what it is for all of us, you know, being exposed to the virus if they return, especially those teachers in upper elementary and middle school. Some of the recent science data is saying the children in that age group really could be major transmitters of the virus. There have also been some teachers who've contracted the virus in the summer without students. They were teaching remotely in teams, apparently, reportedly with social distancing and masks, and still in some instances contracted the virus. So we also know it's not only teachers, but you've got other school support staff, the bus drivers, the maintenance staff. And those people are on the front lines trying to clean the building for the rest of us. Nurses, athletic staff, all of those people are at high risk. So what do they need to feel safer? And it's all going to cost more money. And we've already talked about the financial disparities that we went into the pandemic with, but they certainly need plenty of PPE, the personal protective equipment. So the masks, now the CDC and Dr. Fauci, they're saying face shields or goggles, sanitizers, gloves. I would say some of the non-teaching staff, those people working at the front office, similar to our retail workers, would need plexiglass possibly at the front office. The science is telling us that poorly ventilated buildings are a major concern with this virus. And if you reflect on the problem that we had with buildings prior to the pandemic in urban schools and rural schools in particular, that tells us that we have some work to do there. Some health experts are even recommending that teachers try to invest in disposable clothing, similar to medical workers. So some teachers are buying scrubs that they can throw away on a daily basis. That's expensive. So these disparities have been exacerbated, as we've all shared. There, Washington Post columnist said something about those disparities, said the novel coronavirus has put sticks of dynamite into the cracks of our society, turning them into the canyons that must be navigated.
Great. Yeah, thank you for sharing that quote and for pointing out that tension between the, the rights of teachers and doing what's best for the students. Obviously, there are a lot of different groups that have a lot of different needs and concerns. And I think as we move forward, it's important to make sure everybody's voice is heard and all of these different kinds of needs are considered, so that we can start to pave a path forward that addresses all of those things. So as we come to a close here, Dr. Perry, would you mind just sort of giving us your sort of concluding thoughts, kind of your main takeaways, what you're hoping for as we go into the fall semester and beyond, as we sort of work through all of this?
Yes. I want to start with just this quote that I found by a young man who posted about the pandemic. He says, "We have a chance to do something extraordinary. As we head out of this pandemic, we can change the world, create a world of love, of difference, of change, a world where we are kind to each other. Let love and kindness be our roadmap." And what I say to this is that I know it seems very optimistic, and I know it seems as if it may escape some of these things that we are talking about, but it does not. What it really gets to is that this is an opportunity for us to make some real changes. That Dr. Loder-Jackson mentioned in her quote, those gaps that exist, we have an opportunity now to fill those authentically in a way that's systemic, not just by patching, but really make a difference. And so I want to go back to the student that I discussed with you earlier. His name was Ronald. Ronald being able to have access to an education, his family being able to help him get an education. I want to end with Ronald actually got a donated laptop, and he completed his schooling using community Wi-Fi. But Ronald doesn't have to be the only one. What can we imagine this world as in education as we go forward? We know that he truly has a right to an equitable education. And what will make this happen? One, I think that we need to think about how we make computers available to every student. We've both alluded to that all of these are going to take money. But what can we do? What can we do to create a strong internet connectivity for everyone, no matter where they live, they have access? What would that do? How can we support teachers as they develop their understanding of digital learning, be able to support them in their own families, be able to support them in their own work environment, to help them be able to help their students better once their students have more access? What can we do to provide for families and help students and their families with flexible work scheduling, help them within their communities, help them support each other? What kind of structures or infrastructures can we provide? And lastly, what is it that we can do to help make circle families, families that are supported socially and emotionally, they are supported within their own structures, so that we can help them navigate these times. It's really interesting, where we need to depend on each other, although we can't see each other always face to face. But these are opportunities that we have that I think we should take advantage of.
Great, thank you so much. Yeah, those are great questions and great goals. And I hope that as a society, and really this is a global issue, this right to education, certainly that has come to the fore with the pandemic. So lots of issues to address, but I have hope, going forward that the exposure of these gaps and these cracks will lead to some new conversations and some new solutions that we can use to improve the education system, both nationally and globally, for students all over the world. So we are out of time for today, but I wanted to reiterate my gratitude to each of you for joining us and for sharing your expertise on these very important issues. Thank you all for the incredible work that you do, the very important work that you do. I hope that you all have a great semester despite all of the uncertainties. And to our audience, thank you so much for tuning in today. If we didn't get to your question, or if you have follow-up questions for our panelists, please post those on our Facebook page. And don't forget to sign up for our newsletter. We'll be posting our fall schedule soon, and we would love to have you join us for the upcoming events as we continue highlighting these important human rights issues, especially as they relate to the pandemic. So thank you again so much. Have a great day.